Well, this is Paul Halverson. I'm so glad to be joined today by Dr. Virginia Caine. Dr. Caine is, among other things, is the Director of Health for Marion County Health Department. She's also an infectious disease physician and on the faculty of the IU School of Medicine. So we're so happy to have you, Dr. Caine. Thank you for joining us.
Thank you for having me.
So, and we're doing this Public Health 101 for our medical students, and these are folks that are involved with a scholarly concentration in public health. And so one of the things we want to try to do is to talk to folks in the field and just tell your story a little bit. I know you and I first met when you have some Arkansas roots, and so do I.
Uh-huh.
And so tell us a little bit about where did you go to school, how did you get interested in medicine, and where did you go to medical school? Just sort of early training and experience, and then we'll get into the public health stuff.
I'll be honest, my father was a scientist. He was chair of the biology department at a Black Historical College, and then became University of Arkansas at Pine Bluff. So he always used to make me read science books and everything. So I guess I came by that part naturally. But he bought me my first chemistry lab, and it got me a little microscope too, and whatever. So I got fascinated with chemistry and fascinated from the biological side. And so I actually went to an undergraduate program in Minnesota. I got a scholarship. So I just saw their picture on their monogram book, and it had a chemistry stuff on it. So I said, I might like to go to that. And so got a scholarship. So I froze to death for a couple of years.
And so that's where you got your undergraduate degree.
So, yes. And I was actually going to become a biochemist. Okay. And I was in my third year. And actually Purdue University gave me a slot to be for getting my PhD in biochemistry.
Wow.
But I got tricked by the chairman of the biology department because he was a pre-med advisor.
Oh, okay.
So he was there was a program at Harvard where undergraduate students from minority populations could take 2 actual classes from Harvard's medical school, and then you do a preceptorship with a Harvard professor for the summer. Yeah. And so he encouraged us to apply for this. Yeah. And, of course, there were 3 of us, and both of my girlfriends and I, for some reason, we missed that deadline. Uh-oh. And we said, oh, good, we're going to enjoy ourselves this summer. I'll go work back in my old job. I used to work at Timex Watch Factory. I used to put the second hands together. Okay. But at least I'm getting away from the books, I have a summer to breathe. Yeah. And so he calls us into the office, and he says, well, guys, I'm so excited about you possibly having an opportunity to go into Harvard this summer, and you just should have seen our faces. We're just so sorry, but we unfortunately got so busy and tied up we missed the deadline. And so he says, hey, you're in luck. I thought you might be busy. So I filled out the applications for you, and guess what? You guys are all accepted.
That really happened?
Yes,
wow,
that's
amazing.
That really happened because one of his students, Talmadge King, was the liaison and a graduate from my program. And Talmadge King now is the dean of the School of Medicine, University of San Francisco School of Medicine. So he's the dean of medicine now.
So you went to the Harvard program.
So I went to the Harvard. I got 2 straight A's, and I enjoyed immensely the work, working with the pediatrician and seeing the patients and whatever. So that's when I fell in love with medicine. And while you're there, they have different medical schools come around and offer you a job, and so they interview you. And so one of the schools at State University of New York at Allstate in Syracuse said, hey, we got a spot open now. Don't go back and do your senior year. Just start medical school in September.
Oh, my gosh.
Right. And so just a dumb bunny, I took that spot instead of enjoying myself my last year because I was going to Paris, France, and having a good semester and whatever. So if I
So
knew
it was
what I knew
medical
now.
school instead.
Yes, so it was medical
Wow.
school instead.
So you finished medical school in New
Yeah,
York?
I finished medical school. I did my internal medicine at University of Cincinnati, and then I did an infectious disease fellowship out at University of Washington in Seattle.
Wow.
And my first faculty job was at Johns Hopkins.
Great places.
So yeah,
And terrific experience.
Exactly. I was a research hound in those days when I was at Hopkins.
Yeah. Wow. How long were you at Hopkins?
So I was at Hopkins about 2 years. So I was
Okay.
like the co-investigator of an NIH grant. And so Indiana University, the chief of infectious diseases, said, wow, we'd love to get that same grant here in Indianapolis, but instead of you being a co-investigator, how about if you come here, we'd like to attempt to get you being a principal
you to be the
investigator,
PI.
right?
Wow, that's
whatever.
great.
So I came and we were very successful getting that grant.
That's wonderful. And so you came in an academic research
Yes.
position.
So I'm an academic researcher.
How did you find public health?
So part of my research predominantly involved working in the public health and with our patient population. And so I was familiar with public health in that sense.
Yeah.
And in our actual, I was director of the Sexually Transmitted Disease Clinic, and that clinic is actually on the IU Med Center campus. We were co-located with the Caine Institute of Cardiology.
Okay.
And whatever. So, so when there were research studies to be done, because I had the connection with the public health. I had a joint position with public health in order to do the research with the patient population and running their STD program.
Wow.
And their infectious diseases for the health department.
And I'm trying to remember, that was there was a building where I think Reagan Street Institute is now at, right? Is that right?
Yes, that's
STD
correct.
Building?
Yes, that's correct.
Yeah.
That's correct.
So how did you go from the STD program to being the director of the health department?
So,
Seems like a big jump.
So hollering, screaming, and dragging my feet. So I had a major research initiative going on, and we had lost the director, and so someone had submitted my resume to the board, recommending me for the director of the health department.
Oh, my gosh.
And I was very nice. I sent a certified letter to every board member, just saying I was very flattered and very gracious, but I was not interested in the position. Okay.
Sounds like your professor from before that applied for you, right?
Right. But Dr. Hank Bach, well known for his work being the chief medical officer for the Indy 500 and an emergency room physician at Methodist Hospital, was the chair, and I think it sent my resume in, stated that, well, it's no problem. We have to pass the budget for the health department in 2 weeks. And so if that budget doesn't get passed, we're unfortunately have to tell you that your research initiative going on in the clinic is going to be discontinued. So if I were you, he says, I might consider being acting long enough to make sure your budget gets passed and then give us time to find somebody.
Oh, my.
And so that's how I became the acting director. And then it's intoxicating because you learn that you can have a lot of influence from a population health standpoint, but you also bring a different perspective to the health department that they did not have from more of an academic bent. So we're more of what's considered an academic type public health department because we're used to doing evaluations and recommending new guidelines. So new recommendations. So this is how you should be treating these patients, and this is what you should consider.
Yes. Well, and I think it's really interesting and important to say that the Marion County Health Department, unlike most every other health department in our state, actually has a full complement of staff in many of the key areas of public health.
That's correct.
And you have built a very, very strong team and a strong health department from a functional perspective. I think perhaps Marion County and maybe Allen County to the north,
right,
in terms of the two really sort of full-service health
right.
departments.
But let me just say, in terms of the smaller health departments,
right,
we've got some dynamic public health physicians
right,
and directors of their
right.
programs. But no matter what anybody tells you, a health department from a larger city has way more advantages than a health department in a smaller city.
True. Yeah.
Because what really turned us around and carried us to that next step, when I came on board, we had about maybe $2 million worth of dollars into grants. And I clearly realized very early on that, people assume that you're getting a lot of money from property taxes. Well, you realize Indiana?
Yeah, you're
got
not.
The lowest
That's right.
property taxes almost in the nation. Okay, we rank in the top 10, getting the lowest amount of support for public health
That's right.
funding.
Yeah, ranked 48th
right.
now.
We're
right.
48th, so that means only 2 states get less money in public health funding than we do.
Yeah.
So if I'm depending on property taxes, I got no money to hardly do
that's right.
a lot of stuff. So we said we got to get into a different business.
Yeah.
So I went into the business first with the foundations. I joined the foundation, one of the largest health foundations in our Indianapolis community. Eventually became the chairman of the board.
Wow.
And eventually said, hey, I got to talk to these other foundation folks. They're not doing a lot of health stuff, but can we change their minds?
Right.
And I had a remarkable executive director, Betty Wilson, knows everybody.
Yeah.
Who was the longtime executive director of the Health Foundation of Greater Indianapolis. And all the foundation folks, they meet several times in a year. So she got me in front of them, and I made my pitch to get involved in health, and lo and behold, Fairbanks Foundation gave me over $200,000 to do a screening for all the children for obesity, and then Dean Harrison.
Yes, that's right. That's when we met.
Right. Yeah. So
I was the health officer in Arkansas.
I contacted you because you'd already done it.
Yeah.
And I said, wow, I don't need to reinvent the wheel. I just need to find out from your expertise how you did it and whatever. And we translated that here in Indianapolis, and very, very successful.
Yeah.
So
you've done so many things in your career in public health, and of course you've served as the president or the chair of the American Public Health Association. You've been involved in the National Medical Association and a whole host of other things. Great on boards and panels and so forth. Would you just recount for the students maybe some of the milestones, things you're most proud of, things you learned the most from, or as you've been in public health now how many years?
So, Paul, I'm not going to answer that question. I'll just say long enough.
Long time.
Right.
But you've had a lot of milestones.
I have just been very fortunate. I've had so many mentors along the way who's helped me with my career, and it's helped guided me. I have to say a gentleman named Dr. King Holmes, who was who I did my training under for infectious diseases in Seattle, helped to connect me in a strong way with the Centers for Disease Control. So I was able to get on a significant number of committees related to that. And I think the piece people quite don't understand is it is very difficult, I believe, for sometimes females back in my day to try to advance, because I'm not necessarily part of their social networks. I'm a black female. I'm not even a male, but I'm not part of that white male social network over the age of 40. So sometimes you have to be a little, I don't want to say the word pushy, but you have to be persistent. Right, okay. You have to be persistent because they don't necessarily recognize you as a force or something that you might be a critical partner. So you have to do a greater job of trying to sell yourself related to that. So, the Indiana Health Information Exchange.
Right,
okay?
right.
That was a huge process that we got started.
And that put really Indiana on the map. We were one of the early states, right?
Indiana on the map.
Yeah.
But I helped to fund that endeavor at the beginning.
Yeah.
Okay.
Well, I would dare say that you're one of the key leaders in public health, and you and I have worked together on a number of boards and committees and so forth, and we worked together before I came here, and I can tell you that the interest that people have in your success has been incredible, because they use you as an example frequently. They say, "Well, you're in the same place where Dr. Caine's at," and it's wonderful. Anyway, I don't want to dwell on that, but except to say that you're a terrific role model. You've always been great working with our students, and I wonder around your advice to medical students. These are folks that are taking an elective course in public health. Many of them are interested in going into primary care, some into specialty care. There may be even a few that might be interested in public health as a career. But do you have advice for medical students as they're involved in studying public health? Anything that you'd say to them as you've learned public health over the years? What would be the benefit for them to learn about public health, and what advice would you give them?
So the key advice is, I think the landscape of medicine is really changing, and even the landscape of public health is changing. And so if you have any little ounce in your body that you really want to do a good job and do the right thing, and you're really in the medical field because of your values and your mission,
right,
then you have to pay more attention to what's happening in your medical catchment area, your medical setting, or whatever that perspective is. And we need people who are not going to sit on the sidelines.
Right.
I'm going to sit here quietly and let everybody else do the work. It doesn't work that way. And if you don't get in there and jump in there, you're going to find out that you may be impacted or affected by things that are happening because you're letting everybody else make the decision. But are they as thoughtful? Do they look at the whole dimensions of things? So traditionally in the old days, you're only concerned about the patient you're seeing in your clinical office. And you just looked at the traditional medical issues. I'm telling them they've got to eat nutritionally really right. Well, guess what? We have all these convenience stores. There's no fresh fruits at those convenience stores, a lot of processed foods, and it might take mom 2 hours by going on a bus to get to a place where they can get fresh fruits and vegetables and whatever. But, hey, you've never even asked the question. You don't have a clue what goes on in their home.
Right.
And it's not even on your radar screen.
Right.
And then you wonder, over time, why is this patient not getting better? I keep talking to them and I'm educating them, but hey, it's falling on deaf ears because based on your education, it's clear you don't know what's going on with them. So you're getting an education based on their lifestyles.
Right.
I had I won't say the name, but there was an attempt at one time to regulate our regulations for inspections of pools. Mm-hmm. And so a clear push to, we don't need to regulate pools, And I had to say, you came from a background where I know your family belonged to the country club, and you could assure that there were inspections being done. But we have a lot of inner city kids, and I went to the public pools, and so, sometimes folks can have accidents in those pools. And if the chlorine is not correct, you can have some hepatitis, viral hepatitis in those swimming pools. You can have some diarrhea type of pathogens in the swimming pools. So they really need to be inspected regularly, and you have to make sure that they're doing the proper cleansing of any pathogens in their swimming pools so that you can be safe.
Yeah.
So social determinants, Paul.
Yes,
social determinants. You got to look at the housing. You got to look at their transportation mode.
Right.
You have to look at their literacy. Health literacy. What's their educational level? I may be talking to them too high.
Yeah.
Above what they understand, and they're just nodding their heads because they know that's the expectation from them, but they come out of the exam room and, wow, what did they...
Yeah.
What they really say, to me and whatever.
Exactly.
I don't know what to do, kind of thing. So.
Well, one of the things that I'm intrigued by, and you and I are working together with this Dip In project with communities and around diabetes, and a lot of that, Dr. Caine, has to do with community engagement.
Yes.
And I know that some of our medical students, they're going to school, they want to be the experts in medicine, and for them sometimes it's a matter of helping to better understand. It's not just that they don't know what to do, but going in with an attitude of I'm the doctor, I'm going to tell you what to do, doesn't work very well in a lot of our neighborhood engagements.
So they're not going to be successful.
Yeah.
And what they don't recognize is people's perception is that, you got a PhD or you got an MD, and so obviously I'm smarter than the persons that I'm educating who may have a high school degree and they may not even have a high school degree. And so I know best based on their lifestyles what should be best for them. And we got so many different diversity of populations here. I mean, we have significant Hispanic, Latino community. We have different refugees from different places. We have the Burmese. We may be the largest Burmese population in the country housed here. And so you really have to understand their cultures and their lifestyles and try to work with them, engaging for a healthier lifestyle.
And working within their neighborhood means really understanding their community, right?
You have to understand their neighborhoods, but you also have to recognize who are their leaders. And sometimes the perception you have of who are their leaders, may be just totally are different.
Yeah.
I'll never forget, I used to have an older senior female Indianapolis resident make an appointment and see me every year, want to have lunch with me, to basically tell me what we health department need to be doing related to smoking. She was a member of the American Lung Association. And she kept telling me, hey, my son can help you out. And I listened to her and whatever, and I'm saying to myself, it's tough dealing with this smoking legislation and whatever. She says, no, I am telling you, my son can help you out, and I'm just nodding my head. I'm just saying yes. And so I'm over at a Lilly Pharmaceutical meeting where they have all the hospital CEOs that are there from every hospital system. And at that time, Dan Evans, who was the CEO of Indiana University, he comes over to me and he says, well, what have you done? I said, well, what do you mean, what have I done? You sick my mother-in-law on me. What do you mean I sick your mother-in-law on you? I don't know your mother-in-law. He said, yes, you did. You just met her, had lunch with her, and now I'm supposed to be involved in helping you try to, and I'm trying to say, are you telling me that this lady I've been meeting for over 5 years is your mother-in-law? He says, yes, and she calls me at 6 a.m. to tell me all what I've got to do.
Oh, my gosh.
And I just fell out laughing because I had an asset and a connection and a relationship way earlier, but I didn't realize it. Because I made a certain perception, and this is biases. Yeah. So the people you least suspect, who may have a lot of influence, I just didn't make that connection, and I should have. But I'm learning.
You're very smart, though, and we have worked a lot together, and I appreciate your understanding and your willingness to engage in a lot of different issues. Well, I know our time is coming to an end, and I know you've got a very busy schedule, so I just want to say thank you for all that you do and for sharing with us a little bit of your story. And I would just say to our students, if you ever have an opportunity to spend a few minutes with Dr. Caine. I think you'd find the experience very enjoyable. You've got a wonderful experience, and I know you have a heart for students. And if you have the opportunity to spend any time at all with Dr. Caine, I know you'd find it very
But
interesting.
the wonderful thing is we've just got some fantastic students, and I learned from my students. I just saw a student that was a student that did public health and was a medical student who's now taking a major leadership role at CDC, Dr. Laura Quilter. And I'm there for a CDC meeting, and I went down to the canteen to get some coffee and orange juice. And this person's in a uniform. I said, "Don't I know you?" She's looking at me. "You should."
Yeah.
I did a rotation with you, Dr. Caine.
Yeah.
And I'm saying, "My God!" And I say, "Now you're a team leader now, and everything."
That's great.
So it's some great successes and some great careers for people who go into public health. So
well, I also know that
she became an EIS officer.
See, well, that's such a great program, and we've talked a little bit about the EIS program. We'll talk more about it, but one of the things I also know is that in addition to what is a full-time plus job of being the health officer for Marion County, you also are so committed to teaching. You still have attending responsibilities. You still have fellows and residents, and spend a week at a time, right?
I love our public health hospital at Ashkenazi. That's my heart.
Yeah.
And the patients that they serve, and they do an incredible job, and the quality of the services that they offer. This community, it puts Indianapolis on the map for the community values and the services that they provide.
But you said a really great example, because I guess part of the message I'm trying to communicate is that you've taken on public health. It's more than a full-time job, but you've also made time to maintain your skills in clinical medicine. You still teach, and you're still such an incredible resource for all of us. And I know a member of our National Advisory Committee and our adjunct faculty. And anyway, we appreciate you so much. Thank you for being with us today.
Thank you for having me.
All right.
Okay.
Take care.
I appreciate you.
Bye-bye.